Hi friends, so this is the case of pulmonary alveolar proteinosis. Pulmonary alveolar proteinosis basically happens to be a rare diffuse lung disorder which happens due to the ineffective clearing of surfactant. Normally in our lungs, surfactant is being produced and also the older surfactant is being cleared with time. And this clearing of surfactant is taken care of by the GM-CSF molecule, which is a granulocyte macrophage colony stimulating factor. So these will produce macrophages that will eat up the debris of the older surfactant molecules. That's usually what happens in a normal physiological state in the lung. However, in some patients aged between maybe 20 to 60 years, there is a congenital deficiency of this protein, which is GM-CSF, that leads to ineffective clearance of the older surfactant, thereby leading to the alveoli being pooled with a lot of surfactant. Whenever there's a pooling of so much of surfactant in the alveoli, that is what typically leads to the dense reticular pattern or the crazy pavement pattern, as we can commonly see in the HRCT. Diagnosis is predominantly established via a BAL, and the BAL will show pus-stained positive fluid in the alveoli. The treatment of pulmonary alveolar proteinosis usually involves a whole lung lavage, which is done usually under general anesthesia, and we are usually, going to take hypertonic saline and wash out the whole alveoli. That's basically what we mean by a whole lung lavage. And the prognosis is usually good. Usually patients do not end up into very serious complications. However, if there are some underlying infections which have triggered the pulmonary alveolar proteinosis, maybe like a mycobacterial infection or maybe a Pneumocystis jirovecii infection, then the chances of mortality are relatively higher. So that is our case, pulmonary alveolar proteinosis. Remember, it is always going to show a restrictive pattern on spirometry and a low DLCO. So thank you for a patient hearing and happy learning.